welcome to IHW Podcast. I am Sukshim Sharma, your host for today, as we are joined by the visionaries in the healthcare sector. Today, I'm joined by the Colonel Rajeev Mannali, who is CEO, SUT Hospital. Welcome to the show, sir.
Thank you.
Since I'm very fascinated about your army background and everything, sir, I would like to know that how the learnings from army culture really contributed to the working of the be it bringing discipline to the hospital and your leadership role as well. Please throw some light.
Oh, that's a very interesting question. I think Army creates jacks of all trades, and Army gives you some very, very important training blocks, which I think can be very usefully and correctly used in the corporate world too. Unfortunately, I am not too sure if that is being used to the extent that it could be of benefit to the country. Having said that, coming to me personally, I think I would qualify myself as having been extremely fortunate to step into healthcare almost immediately after my superannuation. Why healthcare? I don't know. I think divinity must have decided that sometime back. But how it has helped me is, firstly, it has helped me learn and relearn, because I've been trained right from my National Defense Academy days and onwards thereafter for almost 34 years to destroy the enemy by using all means. Now, the destruction part, leaving it aside, I was now called upon to create, save lives, and get into every aspect that does that. That's been a solid change in my role. But while performing that role, my army background has come in, helped me immensely. One is that I think most of the workplaces today lack the requisite discipline that is called for to maintain the environment, the ambience, and also the outcomes. So therefore, wherever I have been now, I am into the 5th hospital. I have also been in CMC Vellore also. So all these put together in all these places, I think the first thing that I've been able to achieve is instill a sense of discipline and instill a sense of self-discipline, not just enforce discipline. So that self-discipline, creating that has actually made me turn around things. Fortunately or unfortunately, right from my first hospital onwards, except for CMC, and CMC also, I was coming up with a complex, Chittoor complex, which was not actually taking off. So in all these areas, I've been able to use my, caliber to bring around discipline. That has helped all these hospitals, I think. And it has helped the turnaround also in most of these hospitals where it was required. That is one. Secondly, that sense of purpose. One is the sense of discipline. Second, the sense of purpose and the way you get to that goal or the purpose. That has also, the journey has been, in the army, that journey is very important. How you get to your goal. So that mission accomplishment has also been a very important aspect as far as I am concerned. And passing it down to the last person. That has been also immensely helpful, I feel, because the team works together. Firstly, you create the team, then the team works together and achieves the goals which have already been selected. So, and army, I do not know how much the public know about it, but we work as a team. No one is important or no one is unimportant. Everyone is equal in our teams. And that teamwork has also been that creation of the team and ensuring that the team works together cohesively as a team. That has also, I think, immensely helped me in achieve my missions. So these are the major aspects, I think, where the army training has helped me.
So, sir, since we're talking about smart hospitals today, and as you know, I was preparing for this interview, as I was going through the hospital's profile and everything. You guys have done a lot in the region. Please take us through the journey, and some of the innovations, or in terms of technology also, that you have been using, and that actually brought some change in the patient's life. Anything that you want to mention?
I think I have been with my current hospital, which I think now I'm actually wedded to my hospital. I think it is as if this is where I always belonged. When I joined, the hospital was passing through a lean phase, a trough actually. So, this I had to really rework the entire process. The team was divided. It was not, there was no sense of purpose. I had to create a team which could work together and get to the goal. And I wanted to make in keeping with the vision of my promoter, Dr. B.R. Shetty, who's a well-known figure in the world of even healthcare in different parts of the world. With keeping his vision in mind, I had to translate it to ground. So there was a connect between the promoter's vision and our actual implementation of the same. Just to give you an example, Dr. B.R. Shetty, when I took over, just told me one thing, that let always the purse is not important, the pulse is more important. Let the pulse be more important than the purse. The depth of that online is immense. So therefore, how can you help the patient, irrespective of his social standing, irrespective of his financial standing? And while doing that, you also have to be profitable to sustain. So sustenance, and along with the sustenance, the social goal of doing something for the society, which has in any case made you. So it was, for me, as far as personally concerned, it was a give back to the society time. And I think we have been able to achieve that. And how we have done it is firstly creating the team, instilling the sense of purpose, sense of discipline, and ensuring that the patient comes first, and the patient experience is actually a delight. We have used WhatsApp groups to great benefit. We have WhatsApp groups involving the people concerned in any activity in the hospital, to talk about discharges and admissions, to ensure that there are no delays. Then complaints group, so that if there are any infrastructural problems or day-to-day functioning problems, the complaints are brought in there and it's addressed immediately.
So everything is digitalized that
it is. We are basically using WhatsApp groups. I have a tendency to put cost optimization before everything else. So I have not inducted technology for the sake of technology. What we have done is we have adopted technology to meet our requirements and to be cost effective. Cost optimization has been at the a basic philosophy as far as we are concerned, because we have not increased the tariffs in the last 7.5 years. So how do you do it then? Cost optimization is the only way and the most effective way, which we have proved it actually. So, and we are also doing a lot of social involvement, creating awareness on various diseases, carrying out camps and things like that, and going to the tribal areas and doing whatever we can. So all this put together, and also at the same time maintaining that profitability, minimum profitability, to ensure sustainability, has also been our forte. So not increasing the tariff in a hospital for 7.5 years is something huge. Yeah. So that we have been able to achieve, and we are making steady progress, both commercially as also all round.
Right. So since you talked about the digital, platforms that you're using to, add it to the process in the hospital, do you think the technology actually contributed in terms of, helping doctors? We generally talk about burnout in India, and, when we talk about doctors, the first thing that comes to our mind are, the odd shifts, the extended shifts, and stuff like that. So, do you think technology has actually helped doctors in this regard?
See,
Or is
technology.
it, is it like adding to the system that, they have to learn new things now?
Uh, Actually, you have given me the answer yourself. Uh, there is a very thin line between actually overdoing things. Uh, Adaptation or introduction of technology only where it is required. Like I was giving an example. Surgery can be done, open surgery, laparoscopic surgery, and even robotic surgery. But what is best for the patient and keeping his financial condition, etc., uh, in mind, I think that should only be tried. Robotic surgery, just because it's available, need not come into my hospital. Outcomes are important to us, not the means. So, in the outcomes, cost is always a deciding factor. So, keeping the cost in mind, providing the best for the patient, and also creating that patient delight and sustaining it. We have a system of feedbacks. Like, I'll just to give you an example, we use Google for that, Google review for that. When I started my journey, or SUT started that journey, let me put it that way, we stood at a Google review of 3.3. Today we are at 4.8. So it is that what we have done for the patients and what we are doing for the patients, we also find that it's coming back to us.
Right.
They are recognizing that fact. They are recognizing that, and that has actually given us a reputation that this hospital cares. I think that's the best recognition and the best reward that you can get is the feeling amongst the public that you care. And SUT cares is now well known in our surroundings. I think that's where we have used technology. We have not used technology for the sake of technology. Our thrust has been technology where required at an affordable cost. If it is not affordable, we have not considered it. So that is the process, or that is the approach that we have had towards technology. I'm actually against induction of technology of all sorts just for the heck of it. Where we require it, where it can improve the patient experience, where it can improve the outcomes, there we do not hesitate to introduce the technology or induct the technology. But technology just to create that wow factor, we don't go in for that.
So, since you talked about the patient experience, there is also a lot of hesitation among patients when it comes to technology. Some of, the mid-age people, or say youngsters like us, they are more into technology and they are not hesitant of using it in any, platform, or say hospitals or any sector in this regard. So but there is also a section who are hesitant and, who don't know anything about the process, and they are also not ready to learn. So how do you tackle this kind of section?
That is a very, very interesting question, and which every hospital has to find its own solutions. How we have handled this, that we have used our guest relations to a great extent. Our guest relations actually acts as a friend to the patients. Anyone who cannot use technology and all that, there is this guest relations department waiting to help them out. So we do not force them to do anything. They remain they in their comfort zone. They need a help. They are either ask for it, or our people reach out to them. So guest relations department is what we have employed in extensive measures to ensure that all everyone has been included in the system, irrespective of where they belong to, what they belong to, and all that. We have ensured that there's a department specifically for this purpose with clear instructions that they need to look after every patient who comes in.
So basically a help desk department that is there.
Yeah. And they are available at every point of service or point of service delivery.
Okay. And so since you're at the IHW event and, we are talking about smart hospitals, diagnostics, what are your thoughts that, forums like this are bringing change and contributing in this context? So do you think that, events like these are actually contributing and, should often take place? And how should people, come together and talk about the common cause? What are your thoughts on that?
I think it is extremely important to have organizations like IHW taking this aspect of spreading awareness. It is any amount of or any number of organizations creating awareness is still not good enough in a country like India. This is the second event conducted by IHW that I am attending. There was an earlier one, I think about 2 years back, on lung cancer. I chose to attend that basically because cancer is a nuisance, it's a menace. And there's pretty much little being done about whatever we are doing is not enough to meet the requirement. Therefore, I felt that we need to put our hands together and come to a platform. And I think the awareness created by a single event like that, it stood out. And now smart hospital, everyone is talking about being smart. But what decides your smartness? I think IHW has set the tone right and the context right. It is not about spending money or just inducting technology for the sake of inducting technology, but using it where it is required without losing that sight on the patient, his well-being, his affordability, his accessibility, and ultimately what is he looking at? He's looking at the outcomes, and he's also looking at the experience that he gains while achieving that outcome. That is where the hospital or any healthcare organization has to focus on. It is the patient who is first, and you must be able to do whatever technology, no technology. I think the human mind is the most important source of technology. Utilizing that, even simple things like your WhatsApp groups can do wonders. So, technology where it is required, when it is required, in the appropriate measures, in areas where it is required, if it is adopted, I think it'll add to your value system and also bring more value to the environment.
Absolutely, sir. Thank you so much. Thank you so much. This conversation was really insightful. Thank you for your time. Thank you.
Thank you very much.